Dr. Paul Enochs with Surgical Specialists of North Carolina explains two of the most common bariatric surgeries. Let's start with lap band.
It's a procedure by which we take a silicone adjustable band and place it around the top of the stomach laparoscopically and connect it to a port that sits below the skin. Inside that band there's a little balloon that when you fill the port up with fluid, it causes the balloon to get a little bit tighter, enabling a patient to feel less hungry and more full. Compared to other weight loss surgery procedures in the past, there is no stapling of the stomach, there's no division of the small intestine, and so as a result, the risks of this procedure are pretty much similar to any other laparoscopic procedure.
Here's how gastric bypass surgery works.
We staple across the stomach to create a pouch about the size of an egg. We then bypass 25% of the small intestine to allow a patient to eat less and absorb less of what they eat. By eating less and absorbing less of what they eat, they can lose weight. As far as the differences between the two procedures, some people find the lap band appealing because it's an outpatient procedure, less invasive, can be reversible, and has less risk.
Although it requires a hospital stay and longer recovery, gastric bypass does have certain advantages.
You do have a quicker weight loss, 50 to 75% of your excess weight within the first year with the gastric bypass, as opposed to 50 to 60% of your excess weight over 2 years with the lap band.
It takes more than surgery. Patients still have to get plenty of liquids and proteins, avoid too many sugars and carbs, and of course exercise.
If you take that tool, add to it the principles that we talk about, it's easy to see that you could lose 50 to 60 to 75% of your excess weight and get down to where you need to be.
Experts say do your research. The American Society of Bariatric Surgery provides guidelines. This is surgery. It does have risks.
But the risks of not doing anything at all about your weight far exceeds the risks of surgery.